Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
One of the commonest aspects of aging is that arthritis joins us along the way, for most of us anyway. One of the things that I was surprised at is how exercise was capable of minimizing the negative impact of arthritic changes and the pain of the arthritis. Because I remember when I started out, before I was exercising a lot, I had a lot of pain in my knees and all of that. And after months and years of exercising, much of the pain went away. But that's not true for everybody, but it may be true for some. So that osteoarthritis is something that most of us accept that as we grow older, we'll have the joint pains that go along with arthritis. And there are types of arthritis: rheumatoid arthritis, and there's osteoarthritis. The one thing about the arthritides is that they are associated with pain. And the aspect about the pain is that you would think that the way to decrease that pain would be to immobilize yourself, but it's just the opposite. That the more you exercise, the better it is. And I think you pointed out that fiber helps. Of course, gout is a cause of arthritis as well, but that's a different specific type of gouty arthritis that is remedied by medications. Uh, so that I think the diet you eat, the exercise programs you participate in go a long way to dealing with the different types of arthritis. Rheumatoid arthritis is a particular type of arthritis that actually requires certain specific medications. Uh, and it's different from the garden variety osteoarthritis that most people have because we jumped up and down on our knees and ankles and did all kinds of things while we were young. And we kind of pay for it later on. And most of the basketball players and some of the football players wind up with osteoarthritis that cripples them and makes some of them become wheelchair dependent or require crutches and those kinds of things, canes and those kinds of things. Uh, but what has been your experience? How many of you have arthritis?
I have my hand up. I had a
Okay.
couple of comments, couple of questions. One is the relationship with gout. What is gout? I've heard about it. I thought it's like swelling, but
Well, that's wonderful that you don't know anything about it, because gout is a condition in which the urate level becomes very high, and this causes depositions in the joints of the hands and the feet, and this gives you one of the most painful conditions that you can have. It compares with the pain of pregnancy in terms of giving you 10 out of 10 pain. But it is treatable by medication. Colchicine and other medications like that will actually cure the gouty arthritis. And it's often associated with meats and alcohol and other things like that, in contradistinction to the osteoarthritis.
okay. So is arthritis an autoimmune disease?
Say again?
Is arthritis an autoimmune disease?
Oh, arthritis is generally not an autoimmune disease. Rheumatoid arthritis is an autoimmune disease. And so therefore the medications are appropriate therefore. Whereas Osteoarthritis is actually a degenerative disease, which our joints traumatize so much that they fight back and they give us pain.
Yeah.
Any other comments or
Co-
questions about this
yeah.
entity that we become familiar with as we age?
Causes of gout, typically diets rich in red meat, sweetened beverages, alcohol consumption, especially beer. Earlier in the article was talking about helping arthritis with cereal grain, and that's not talking about breakfast cereals. That's talking about whole grains such as wheat, millet, barley.
Thank you. Thank you for that comment. Any other comments or
One thing that had been mentioned was perfect practice. And I have Arthur, and it seems to come on very acutely. And when comparing both my right and my left hand, they were the same, but the pain in my left hand was arthritis that was already there, but it was the trauma that I experienced from a fall that then made the pain worse. So perfect practice, being as we age, being aware of our core and being able to prevent falls and things like that are very important to the aging degenerative joint.
any other comments about arthritis?
I have arthritis around my neck area and shoulder area. And it's not because I did anything special during my early days, uh, like throwing a baseball or stuff like that. It's just, I don't know. I think it's related to the injuries I've had to my back.
Mm-hmm. Okay. It seems like the area that we use the most is the area that is often the area which the osteoarthritis manifests itself. And as Dr. Brent says, if you had falls or traumatize any part of your body, that could be the area that gives you the most trouble as you age. Okay, let's go to the next one unless there's any additional comment. Now, this is a subject we've talked about for a while, and what is perplexing and disturbing is that it's the adolescent suicides is increased to ages 10 to 19, regardless of gender, age, and ethnicity. And the Black and females are the ones that are suffering the most, although it seemed like decades ago, suicide was less common in the African American population, but that has changed remarkably, especially since COVID. Of course, the thing about suicide is that most of the men who try to kill themselves succeed, and many of the women who try to kill themselves don't. And so it's an interesting difference between males and females, and also, of course, the use of firearms and suicide is alarming. And there's no ethnic group that is spared of this mental health issue. Any comments about suicide prevention and addressing the mental health issues that are responsible for this?
as a pediatrician, in my training for Black adolescents, it was almost unheard of.
Yeah, it
And
was.
and
Yeah.
the primary reason, was because they felt that their parents would kill them. It was the major sin. I mean, the sin for which there was no redemption. So it didn't even come into your mind. But with social media, it has become a thing that if you weren't thinking about it, now it comes into your realm of possibility.
Yeah, there was a time when it was also thought by religions that if you killed yourself, you would instantly go to hell. And now we are seeing more people who are religious who are killing themselves. And so it makes you, it's food for thought.
Yeah, a lot of us on this group session have grandchildren, grandnieces, grandnephews, and introversion is a risk factor for suicidal behavior. So it's the quiet ones. If you got quiet kids in your family, try to bring them out. Try to get them uh, more extroverted, more conversational. They withdraw, and you don't know what they're thinking about, but it's not good.
Thank you. Any other comments before we go? I think the availability of firearms has made it worse because probably this is number 2 and number 3 cause of cause of suicide, of death in the adolescent population. The number 2 and number 3 cause of death is suicide. But I think your advice is good, Daryl. Although you have some extroverts who also are suicidal, but it's more of a problem for those people who are introverted and aren't willing to talk about their issues. Now, we talked last week about anger, and this is an article that kind of tells you how the anger goes about causing you to have heart disease and other things. That apparently the anger causes problems in the endothelial aspect, and the lining of all the blood vessels is endothelium. And so if you get endotheliitis, then of course that would lead to arteriosclerosis and other things that really will result in cardiovascular disease and cardiovascular events. So the emotional state of anger is something that is better avoidable, but we're human, and so we get angry sometimes, and it's good to find a release for your anger, so you don't wind up getting chronic diseases from being angry. And this goes back to the point that Darryl made about being able to get it off of you, get it out, rather than keep it in and have it. And it's just like why forgiving is so helpful, because you allow yourself not to be angry about the way people treat you, but to express yourself and let it out, because the anger, as most of these studies are showing, harms your blood vessel function and sets the stage for arteriosclerosis, which then leads to the various cardiovascular diseases. And I think one of the best things to help with anger is to have a friend or somebody you can talk to and get it off your chest, so to speak, because that will help keep your blood vessels from being damaged. So don't just grit your teeth, let it out and talk about it. And any other thoughts, ways that you handle anger so that it doesn't destroy you? Any thoughts?
Dr. Callender, even though it wasn't the intention of this particular article, but is a very old article, Is It Race or Is It Racism? And in that article, the anger that I had because I had to go to the downtown side in New York City to get a cab to go to my OBGYN in Harlem because the cabs wouldn't pick me up going uptown.
Yeah.
So I believe that stole because of the blood vessels and the fact that was my connection to my son, that stole birth weight from him because of the constrictions in my anger around racism. And so if we project this article and the impact now that reproductive healthcare and how it's impacting women, it almost speaks to the importance that there be an uprising and a change in the way we look at this anger and this type of control. Your thoughts?
Yeah, so anger management can save your life in many ways if you know how to control it and not let it control you. Just food for thought. Any other thoughts about how you handle anger when you have it? Because we all have it. It's a matter of how we handle it.
Good morning, everybody. I really think, well, for me, I try very, very, very hard not to ever get angry. I guess I had a mild-mannered mother, and that's who I was around. And anger just doesn't pop out. It's not the first thing that happens when things go wrong or when things, I just, even my husband gets mad at me sometimes because I don't, react the way he feels like I should act about different things. But I just don't feel like anger is a part of my makeup. So I can't even remember the last time I was angry.
You're blessed. You're particularly blessed. Some people have that so it's not in their DNA, whereas others have it so much so that it's every part of their DNA. So, any other comments or thoughts about how you handle anger when you get angry?
I have a thought. I recognize that most of the time when I get angry, I look at the cause of the anger, and 90% of the time it's fear. I'm afraid of something. So it's like an animalistic reaction. I get afraid, so I get angry to get rid of that fear. That's it. Thanks.
Any other comments on a subject that involves all of us?
I can tell you one thing. You can mess your blood vessels up when you get so angry that you beat on a brick wall with your fist.
So true. Okay, well, let's go to the next one. This is a very important article because for many years, women were afraid to take menopause hormone medication because afraid they develop cancer and other things. And so this article talks about a 20-year study that identified that the risk of treating your menopause with hormones really didn't cause a particular risk to patients who were taking those drugs. And so this study involved over 160,000 women between the age of 50 and 79. So I mean, those numbers are pretty impressive. And that the women who had been on the hormones did not have an increase of cardiovascular disease, cancer. And so this then points to the fact that you can treat your postmenopausal symptoms with hormones without being afraid of the consequences thereof. Any thoughts about this very important article that may come 10 years too late for some?
Where did that information come from, Doc, that they were afraid of the hormones?
Oh, there was data that suggested that cancer rates were increased, that cardiovascular complications were increased. So there are previous articles that were not as extensive as this one that indicated that there were increased mortality rates. And so this study, which is involving 160,000 patients and is involved in 20-year follow-up, seems to put to rest the concerns that the use of these hormones can be taken safely. There's much data of small studies that indicated that the increase of breast cancer, increase of cardiovascular disease was a side effect of taking medications to treat the menopausal symptoms.
I suffered.
Hmm.
I suffered.
Say again, Lucy?
I suffered from the hot flashes and all of the things because I was afraid of hormonal replacement therapy. And if this article had come out 20, 30 years ago, I would have had, I believe, a much happier life during that period of time. Because the hot flash it's overwhelming.
Well, that's something that only you women can address for us. Any other, because I see women suffering from it all the time. And as you said, Lucy, you wish it had come out 20 years ago. And I see people suffering from today who are afraid to take medicine to take care of the symptoms because of the fear of developing cancer and cardiovascular disease and other things. Any other thoughts or comments about this?
Yes, yes. I had a doctor, older doctor, male doctor, when I was going through menopause, and he didn't believe in giving hormonal treatment. He said that our bodies were made to handle. And so I never considered it. I never took it. And maybe because I don't mind hot weather, I went through the hot flashes. Still, at some points, it happens still even today, but I never even thought about, once he told me that, I never thought about hormonal treatment or anything. He said it was a natural process, so I dealt with it.
Okay, any other comments from you ladies out there who suffer from
Key factor, he And that's why we need diversity, equity, and inclusion.
That could very well be true.
Okay, if there are no more comments, this is an article that is not surprising, except that I'm not sure the age 40 is low enough, but they're indicating that starting at the age of 40, you need to be screened every other year. The age keeps getting lower and lower, but we keep having people getting breast cancer at younger ages, and that's why. 2023, 43,000 women died of breast cancer.
Is the screening primarily the mammographies?
What's the question?
Is the screening primarily the mammographies?
Yes, yes, and of course, over time, early on, they suggested you examine your own breast, but many have abandoned that because too many women examining their breast come up with masses that are insignificant. And so the principal screening method, as you have mentioned, is mammography.
Yeah, my wife and I were talking about that last night, and she's convinced that mammographies were designed by men because they're so uncomfortable. And if that women had designed them, they'd be much more comfortable and much more effective. Is there any way to change the design and so that it doesn't mash so much?
Yes, as a matter of fact, there's a new X-ray that does not, because I think your wife's analysis is right on target because my wife and most other women think the same way. But there's a new technique, mammography, that is just minimizes the amount of pressure that you have to put on the breast because many women consider mammography to be even more problematic than the vaginal examination.
Dr. Callender, is this number in the United States only, or is this worldwide? 43,000.
That's in the United States.
Wow.
Okay, if there's no other comments, it's
Is there an age where mammograms are no longer needed, or they don't think you should?
I think after the age of 80, I think some people think that you can extend it beyond every other year, but women who are 80 get breast cancer. So it's probably safer to get it every other year, regardless of how old you are.
Dr. Callender, could you speak a little bit about men having breast cancer?
Yeah, breast cancer in men occurs, and it's important for men to examine their breasts as well. However, it's not recommended that men get mammograms unless they find that they have a lump in their breasts. So that breast cancer among men is something to be aware of. And if you have enlarged breasts or you have pain in the breast area, then this is an indication that you might need to get a mammogram as well. At least have a doctor examine your breast and decide whether mammography would be indicated, because men have breast cancer, as you pointed out, John. And I think John Robinson was one of the ones who wrote a couple of papers on male breast cancer.
I have a friend who had breast cancer, a male, and was treated. He's doing well. So it does happen.
Yeah. Now, this is an article for those people who take who are treated for GERDs, gastro reflux, gastric reflux, and the proton pump inhibitors has been associated with migraine in some patients, and so how often it occurs, I'm not sure, but PBIs are very common, but the incidence of headaches is in the range of 30 to 40%, which is high. But I didn't have too many patients who had this migraine as a consequence of proton pump inhibitors. There was some thought that magnesium might overcome the migraine due to proton pump inhibitors. But fortunately, I haven't had many of my patients with GERDs who have gotten migraine as a consequence. What has been your experience? Have you who have GERDs who get migraine from the medication as a side effect?
I had that. I had Prilosec for years, but I never had headaches, no migraines.
Yeah, I really rarely encountered anybody who had migraine from PBIs either. Next article, then let's go. We've had much talk about cannabis and the fact that marijuana has been important for medicinal purposes. Early on, was much talk about its role in treatment of glaucoma. And then after that, it became as a good treatment for vomiting. Then painful conditions emerged that were responsive to cannabis. So that it is clear that there are disease entities for which cannabis will help. And so I think it's important to recognize that cannabis has its side effects, but it also has its consequences that are helpful. And to keep in mind, outside, actually in transplantation, it is also an immunosuppressant as well. So marijuana, cannabis is not something that offhand you need to eliminate. It's just something that, when used appropriately, can be helpful.
Dr. Callender, is there a way to take cannabis without smoking it?
Oh yeah. There are ways that there topical ways and actually there are medications that you can take cannabis without smoking it.
I'm just thinking that smoking anything would be harmful. Just having the smoke in your lungs and all that.
Well, yeah, I think it's just one of the ways in which cannabis can be administered, but it's not the only way. Now, this is for pain, especially osteoarthritic pain. It seemed that much of the study indicated that cannabis could be helpful in reducing osteoarthritic pain. And the real problem with osteoarthritic pain is the medication that you may have to take and the side effects that you get from some of those medications. And so, with this in mind, cannabis can, in some instances, be helpful. The NSAIDs and nonsteroidals have been very helpful in the management of arthritis, but they also have their side effects. This is a remarkable study that talks about a new treatment for malaria in children. That one dose of a monoclonal antibody is effective against malaria. It's interesting to note that every minute there's a child in this world that dies from malaria. So that is still a disease that kills many children. So that having a drug like this, of course it has expenses, is something that merits consideration, since malaria is one of the infections that kills people more than almost any other infection in the world. So that this is a great breakthrough. The problem is that it's an expensive breakthrough. Any comments about this? And most people don't realize that malaria is a global killer. Still, when you go to countries where mosquitoes are prevalent and malaria is common, it is a far too frequent cause of death.
Dr. Callender, what is the difference in this chart here? 70% effective against malaria infection, but then 77 against clinical malaria. What's the difference there?
Now, I didn't understand your question.
This graph that's on the screen,
Yes.
it says malaria infection. It was 70. The monoclonal antibody was effective 70%, but 77 against clinical malaria. What's the difference?
I don't really know. To me, malaria was manifest by the clinical signs of fever and chills, and that, to me, that's malaria. And so I don't know what they meant by the other form of it. Glad you asked that question, because it was a little bit confusing to me, because when I went to Africa, I did contract malaria, and to me, malaria was a clinical entity because it gave you the fever and chill. And without it, to me, it wasn't malaria. But I do not know what they meant by the difference between malaria and clinical malaria. Any other questions about malaria? Of course, since we don't have it in the United States, it's more of a situation that occurs when you leave the United States. But elsewhere in the world, it is a cause of infection and death.
And it's because it exists and because we can do it. It is one of the humanitarian things we must push for.
Any other comment about that? This next article talks about the power of move more and sit less. I think Carol made a comment about that last week when she talks about people offering her a seat, and sitting is dangerous. But it's very clear that when you sit for longer than 15 minutes at a time, you need to stand up and exercise and move, or elevate, when you're sitting, elevate your extremities, because sitting is now the new smoking in terms of a cause of cardiovascular disease. And so that physical activity versus physical exercise. Physical activity is any movement, whereas physical exercise is a planned activity that you intentionally do to increase your lifespan. But point that this article is making is that movement at all is positive and can help you, whereas no movement is lethal. And I think that we need to exercise, and we also need to move around as much as we can. So I think this is something that is desirable to emphasize. We talk a lot about. Oh, Tatum, did you want to read that for us? Oh, okay. Anyway, exercise changes the brain in a way that helps heart health, especially for people with depression. So that it's interesting the impact that exercise can have on people who are depressed, and explains why exercise is so important for your heart health as well as your mental health. So now you have some people who just don't like to exercise, and to me, meditation and exercise are important if you want to age. And for those who feel that exercise is a bad thing, I think it's important to relearn and reconfigure that, because almost every way you can imagine, exercise is a positive influence on every organ in your body. And they point out you don't have to be a great athlete to exercise. Walking is not, doesn't make you an athlete, but it does prolong your life. Biking or swimming are great exercises, and be healthy. Want to benefit from yoga, and this is an article that points out that it's not something that you get a miss with, but it's something that if you do it, you stick with it, and the long-term benefits are ever present. And how many of you, we know that John is a practitioner of yoga. Any other yoga practitioners on the line? Because the benefits of yoga and Tai Chi continue to manifest themselves as being things that you do that increase your lifespan and help you age gracefully. I think that statement there says it all. It's not about substance. It's about showing up, being present, doing your best, and letting go of expectation. And the fact that it is helpful is a long-term benefit. Any comments, John McKenna?
My experience was that I was kind of jealous of people who got together to do yoga, and then once I tried it, I was hooked on it, even though I was only going once a week. And then when COVID hit, my instructor went on to a YouTube channel, and we would pay over the computer and watch the class on the computer, and that's very convenient, extremely convenient. You can do it anytime you want, and it's pretty inexpensive. And instead of going once a week, I was going 6 times a week at at times. I'm down to once a week again. So I got real busy, but all the athletes I see who are professional, you see them out there stretching before the game, and that's what a big part of what yoga does. It stretches all your muscles and joints, and it also focuses on your breathing. Your breath is the source of all your life. So when you learn how to regulate your breath, it really helps. As a scuba diver, I had a tendency to breathe like that, constant breathing. Yoga makes you think about that, and instead of that rapid breathing, inhale slowly and deeply, and then exhale slowly and deeply, and control that breath. It really helps. It's pretty amazing. It also helps you to sleep as well. So that's my comment. Thanks.
Thank you. Next article, please. Meditation and movement as keys to healthy aging. This is something we've talked about time and time again, and I think the two go together just like anything that works. I think mindfulness and meditation allows you to allow your mind to actually be at peace. And in many ways, the combination of exercise and meditation actually synergizes. One synergizes the other. One helps the other. And so, and of course, when you think about yoga and many of the other things, many of them combine the meditation with the exercise. And this is something that is a way of getting your mind to relax and spending time, taking time to relax, which is something we tend not to do. And this is just saying that as you age, it is helpful to be involved with both. Any of you have any comments about the combination of meditation and exercise? This is something that probably many people don't appreciate, but when you, for example, in medicine or any other specialty, when you leave or before you leave, you have to sign a form that says that if you leave, that you will not be in competition with whoever you signed up for. And federal training, this was a common practice. And the FTC now is banning non-compete agreements, which is, I think, almost every hospital who has a physician had to sign a non-compete agreement. So the fact that this is no longer enforceable is something that will make a difference. I guess in many professions, I don't know if in the teaching profession you have it. I know in the medical profession you have it. I imagine they do in the legal profession, but I'm not sure about that. I know it's very common in the medical profession. And so this will have a long-term effect upon people who sign a contract to work for a hospital or that kind of thing. Any comment on that? Not. Okay. Now this is something we talked about last week as well. Banning disability bias. Well, banning bias does not eliminate bias, but at least you cannot use that bias in healthcare. Because somebody is disabled, you can't prevent them from participating in anything else. And many of us have a bias that disabled persons, for whatever they are disabled for, that they can't do this, they can't do that. And this is then to enforce the fact that because somebody has a disability, whatever it is, that it cannot be used to prevent them from getting any kind of health care.
You hear that, Carol?
What's that, John?
I asked Carol if she heard you.
Any other comments about that? If not, this is an interesting article about in fact, when you lose weight, you also lose muscle. And if you lose muscle, that is not so good. Losing fat is probably good for you. Losing muscle is not so good. As we age, we lose muscle. And that's one of the reasons why we get weak. And so we have to find a way of managing our obesity without losing muscle mass, because the muscle mass is what gives us our strength. And frailty, or the inability to do well, occurs when you don't have muscle mass. That's one of the things you do with the exercising, is you build up your muscle mass so you increase your strength. And so this is something that sometimes we're so concerned about losing fat that we forget that we may also be losing muscle, which is undesirable. And the exercise programs that go along with you while you're losing weight will be helpful along those lines.
Dr. Callender, can you address that sarcopenia again a little bit?
Yeah, sarcopenia just means reducing muscle. Sarco, muscle, penia, reducing, which is the antithesis of what you get when you exercise. When you exercise, you build up muscles. So, and losing fat is okay because fat doesn't give you strength, but muscles give you strength. And so sarcopenia is losing muscle mass, which is important to maintain your strength. Any other question about the term sarcopenia, sarcomuscle penia reduction?
My question is really not about the word per se. I'm just wondering, I am in the process of losing weight. I just felt like I knew that my 5'1" frame didn't need 200 pounds. So I have been losing, but now that I have drop foot, my mode of exercise was walking. That's what I did. So now that I have drop foot, I'm not doing that walking. So what exercise would you recommend that I do to help build up my muscles?
Well, I know Daryl will step in, but exercises that stretching and exercises that stretch, that walking is one exercise, flexing and stretching exercises that I do in addition to the walking, and so I'm trying to think the exercise that I do that raising your arms up and down, and you're doing exercises with your uh, legs and the muscles of your legs and the muscles of your thighs, sit-ups and pedal exercises. Those are things that will, and then there are isometric exercises in which you just use your fingers and your hand. But exercise in which you sit-ups are some of the exercises that you can do that strengthen your muscles. So whether you do sit-ups or you do exercises that simple exercises like uh, going up and down with your uh, feet and legs, knee bends, uh, uh, exercises that allow you to use your muscles of your thighs and your legs. Uh, the soleus muscle is the muscle that is called the second heart because exercises in which you exercise your leg muscles build up strength, and they also pump blood back to your heart. So the muscles, uh, using your muscles is stretching and lengthening your muscles are a good way of preventing against sarcopenia or reduction of your muscles.
Okay.
Darrell, any other
But
comments you want to make?
yeah, Betty, do an internet do an internet search on chair exercises. There are some routines that'll get your heart rate up, and where you can actually uh, be sweating while sitting in your chair. And then the other thing is that you can get some small weights, 3, 5, 10 pounds, and do weight training where you don't have to be standing.
Okay, that's building muscles. That's all I was asking. But those types of exercise build the muscles. Okay. Okay.
Yes, yes.
Yeah, it's always good to get your heart rate up a little bit to do some warm ups before you do weight training. And so use a chair routine as a warm up to get your heart rate up, and then do the weight training.
Okay. Okay. Yeah, I
Yeah.
have some chair exercises that I got when I was in therapy. So yeah.
I had a comment and a question. My comment is that the stationary bike is a good way to do that as well. And my question is, uh, sarcopenia. You asked Dr. Callender, you asked any questions about it. My question is that similar to atrophy?
Similar to what?
Atrophy?
Yeah, yeah. Atrophy of the muscles. Yes. Atrophy is where you have wasting of your muscle. Wasting. Atrophy of anything is wasting. So sarcopenia is muscle atrophy.
Okay, thank you.
So they would be synonyms.
Well, Betty, I want to recommend chair yoga. They also have yoga you can do with your chair that you don't have to stand up or walk around with. And yeah, yoga definitely builds muscles. There's some moves that those yogis do that I still can't do. Like the down dog is so hard, planks, it's like push-ups. Oh man, they're challenging. And yet, uh, a lot of those, mostly women in the yoga class,
Yeah,
they leave me in the dust. They're really, really, really strong. Amazing.
yeah, but dealing with this drop foot, I'm challenged as far as moving my legs and moving, so that was why I was trying to come up with something else that would build my muscles while I'm losing weight. That was
Good idea. Good idea.
okay.
Let's go to the next one. This is an article I included because, you know, what's in the name? Uh, you know, we change the name, but does that change the stigma? That's the question. And I don't know the answer to that. And what are your thoughts? Do you think changing the name obesity will affect the stigma related to being too fat? Or do you think it's worth changing? What are your thoughts about it? I think.
A fat person by any other name is still a fat person.
Any other thoughts on the subject?
I tell you, that's one of the reasons I started to lose weight because I hated the idea. Daryl kept saying, you know, obese, obese. And when I got on the scale, I was obese. I was 205, 5'7". I'm down to 179.
Wonderful, great, great.
But
Any other
I'm still overweight.
overweight? Yeah, but not obese. Okay.
I think I think that fat and obesity are different, and that obesity is a disease in and of itself. And I think similar to the way we used to look at a little bit of sugar and diabetes is the way that we now need to look at obesity.
Any other thoughts on the subject?
Yeah, my thought is that you get what you tolerate. When I look at American population compared to other countries, I look at about 90% of whoever I see in America is being obese. You go to Europe, and that number drops down to about 20%. You go to Asia, and China, they stigmatize obesity very strongly. And as a result, there's very few obese people in China. So you kind of get what you tolerate. We like to say in America that we want to not fat shame anybody, that all bodies are beautiful. There's a lot of conversation that says that you can be fat and healthy, but we get all these fat and healthy diseases over in America that are not as prevalent in other countries. So I don't know. We try to say no stigma for anything, but sometimes stigma isn't a bad thing.
Well, it's just like they talk about in school about you don't want to flunk anybody. Well, of course, that makes no sense at all. Some people succeed and some people don't, and you should be the difference. I don't think it makes a difference. If you're overweight or you're obese, they're actually different medical terms. So let's hear some additional thoughts on this.
I choose to agree that we need to change the names because fat shaming hasn't helped not one person in America. America, we are the type, not like other countries, if you can't say someone is a janitor, you got to say that they're an engineer. So people that were drug addicts, as long as they were drug addicts and they were Black, they were just drug addicts, no good, and etc. Then they dressed it up. I forgot what they call it now, but now you got to get, because it is an addiction problem or something else, like even smoking, mental. And so the person doesn't really put the blame on themselves. They got a physical condition that causes them to be overweight. So as soon as they get that new name, then people start seeking advice and medical, etc., because they put on the weight and they can't get it off. So Americans are like that. We're not like other countries. We got to have a cause that's not within us. And if it is, then we need some type of medical or psycho to say that we got to stop this. Because, look at the culture. All of a sudden it was okay as long as the ghetto, which is another name for putting a poor community. But if you lived in a ghetto, you must be Black. But if it's anybody else, that's just you poor, lazy, and no good to get yourself out of it. If you are if a mother got pregnant and she was on welfare, that's because she wanted money. But what happened about the rich people that got pregnant? They all like sex, but it's just how you phrase it and etc. So since we don't fat shame anymore, get another name so people can actually go to help themselves and seek help because they're gaining weight uncontrollably. And they found out that the diet, they raise the food, the cost of food for healthy foods to keep you from losing weight. They put McDonald's on every corner, especially in Black neighborhoods, to keep you gaining weight. So we need to help ourselves change the name, change how it is, so people will continue being, start losing weight and help themselves and live longer.
I think a name change could be pleasantly plump.
No, plump is not a good word. That's a negative connotation also. We need something with a positive connotation because like Dr. Callender said, you know, we the words that we use in America, the phrase now is to feel good about yourself. Everybody is good. We're not doing things to harm us, you know. So help yourselves, help children not to commit suicide by seeing the signs. But before their community was affected, they did not care. And so people are caring now while it's causing them harm. So we need a positive word like a janitor. We don't call them janitors anymore because that's a negative word. We don't call people secretaries anymore, but somehow that's a negative word. You don't call anybody dumb anymore because that is a no word. So we need positive reinforcement. Poor Americans. Oh, I'm sorry. We can't say poor either.
Any other comments? Okay, let's go to the next one. It's an interesting article that people in rural areas die early from preventable deaths more than people in urban areas. And it's kind of alarming because preventable deaths are preventable. And whether you're urban or rural, it shouldn't be a difference. But there is. And this is bringing attention to us that we need to be more efficacious in addressing the rural communities in the same way that we do the urban communities. But in rural communities have less physicians, they have less healthcare providers, and they have less educational opportunities. And so the question is, what are we going to do about it? We seem to now become aware of it. Now, the next question is, how are we going to provide the same information to rural communities that we provide to urban communities? And that's kind of what this article is pointing to, that we have a responsibility, urban and rural, the same. But that is not how it's happened. We don't have as many doctors, we don't have many healthcare providers, and we don't have any people going out to the rural communities to educate and empower them to prevent death from some preventable diseases. Any comments on this subject as well? We've been talking about how product chemicals affect the brain and the household disinfectants killing brain cells. We're being poisoned as we breathe, as we use products to cleanse things and to disinfect things, we are also affecting ourselves. There's a little question that, as we've seen in some recent articles, that asthma is a condition made worse by urban situations, particularly for people who are poor and Black. And so here we have something else now, ammonia compounds that were used to clean off surfaces. And these same surfaces that we're cleaning, when we're cleaning them, we're affecting our brain negatively. So this has called our attention to the fact that we should be careful. And maybe when we use these compounds, maybe we should wear masks to do other things that protect our brains. Anyway, this is an article to call our attention to be careful with what we use for whatever we use. Any comments on this important article?
I just think Americans are fixated on so much cleanliness, especially after COVID, that they're wiping down everything with alcohol and everything else to get rid of germs. And that's not the right. It just plain old soap and water, period. You know, even washing your hands, just plain old soap and water is better than all this other putting alcohol on your skin and etc. That's, you know, we're just so fixated with getting rid of germs.
Perfection is the enemy of good.
Yep.
I don't like the smells of some of the products, so I don't use a lot of chemicals. I'm a soap and water person, but because I don't like the smell. I don't like, and sometimes when you mix two things together, it really gets kind of bad. So
Maybe your nose is good. It's warning you.
yeah.
I have been making surface cleaner and hand soap myself. And I am surprised. I would go to Costco's for, the surface cleaner and the floor cleaner. And, for what I used to buy, Mr. Clean, those kinds of things, over time, over the last couple of years, I've realized that I've saved significantly. And this article adds to the protection that I have, not only for myself, but anybody who might visit me. And I can adjust the aroma to what I like. And so, I recommend it. And, I've received many compliments on my hand soap that has a little bit of vitamin E and, it foams up. So that's a recommendation that I make. And it is so much cheaper.
Okay.
Americans are basically lazy. We don't want to scrub anything. We want something instantly clean. They even have vacuum cleaners now that can vacuum your whole house at night automatically. We want floors that have a mop that will do it instantly. When we clean our ovens, nobody wants to scrub and get the exercise, including me, of cleaning an oven out. So you spray it. So overnight, or you have an automatic oven cleaner that you just turn a dial and it cleans itself. And we lose our muscle strength because we're not using muscles anymore. We just spray, watch the dirt disappear and go away. Even laundry. That's why Americans, we're getting obese, because everything is easy to clean your floor, to wash clothes. Everything is easy these days. Nobody, even farmers, they have machines. I saw the other day, that plant for you and harvest for you. All you have to do is sit down and drive a vehicle, and it will do it all for you. So we are a sit down nation, and we just have everybody do our hard work or buy appliances that'll do the work for us. So consequently, we get no exercise. We sit down all the time because we have something you just spray on there, and it gets all the erosion off, and it's instantly clean. So we're asphyxiating ourselves with these products, and then we losing body mass and no muscles, because it takes nothing to clean a house, especially if you're rich.
Okay. Thanks
Something
for the
is really
comment.
cheap. Something is really cheap but effective is just baking soda and white vinegar. Just let it stay on there for a while, rinse it, dirt comes right off.
But you're lazy if you just rinsing it. If you use some arm muscle and scrub it, it'll be much better for you physically.
True. I'm just trying to be a fan of baking soda and white vinegar.
Okay.
Thank you for your comments. Now, we talked about I think Darryl talked about neuropathy, and one of the things that we recognized for some time is that transplantation actually cures neuropathies, and that's one of the nice things about a transplant, that you get off dialysis, that your neuropathy is likely to be improved. But still, the diabetic neuropathy is one of the issues that perplexes us, because the longer you're on dialysis, the more likely you are to have a neuropathy. The neuropathy of diabetes after transplantation is actually remarkably improved. Also, is if you have a good control of your diabetes, the neuropathy is usually better controlled. So one of the things that is thought to be contributory is the fact when you are diabetic and you don't control your diabetes, which is different from the neuropathy that you get while you're on dialysis, which is probably related to the fact that your kidney, the artificial kidney, is only working 4 hours a day, 3 times a week, in contradistinction to the normal kidney that works 24 hours, uh, uh, 365 days a year. And the element that really addresses neuropathy is the electromyognogram, which tests the muscles and nerves and sees whether you actually have a neuropathy or not, and also measures the extent to which you have the neuropathy. And so that neuropathy is something in which the nerves are damaged, and as a consequence, you have pain, and such a disturbing pain that we do have medications, as you mentioned, which are effective in addressing neuropathy. But the real issue is, how do we keep healthy the neurofilament? And the answer is by, if you have a condition like diabetes, uh, to keep the blood sugar under control. But if you have a condition that requires dialysis, and you only do it for 3 days a week, then probably the best treatment for that is going to be the transplant, if possible. But anyway, this perspective on neuropathy is that we've got to treat the nerves like we treat everything else, and try to get it to heal. And that's the concept that this paper is emphasizing.
So, Dr. Callender, is neuropathy, does that mean like pain, or is that?
Yeah, it's a very painful condition.
Would that be
uh,
numbness as well?
You
Numbness?
have you may have numbness as well, but the issue that people complain about is the pain, shooting pain that they get in the wherever the nerve is damaged, and this pain is why they take the medication. Uh, yeah, the numbness is part of it, but the real issue for the patients who have neuropathy is the pain that goes along with it. Certain conditions like pernicious anemia, vitamin B12 deficiency, and some of the vitamin B deficiencies will give you the neuropathies, which can give you both the burning sensation in your leg, feet, or but it's just the neuropathic pain that is the reason why most people complain about the neuropathy.
Dr. Callender, are there ways to heal from neuropathy?
Repeat your question again.
Yeah, is neuropathy a disease that you can heal from?
Yes, as I was saying, the neuropathy can be cured by kidney transplantation, and diabetic neuropathy can be healed by better control of your blood sugar, so that the nerves can heal, but they heal very slowly. And so, yes. So the answer to your question is yes, the nerve filaments can be healed, just that they heal more slowly than muscles and other tissues.
Thank you.
The next slide will be our last one. And this is a blood test that can predict pancreatic cancer years before the diagnosis. Well, and this is a blood test that looks at the DNA in your blood and makes a diagnosis of pancreatic cancer based upon that. And this is not something that is available yet, but this is something that is likely to become available over the next year or so, which will help us to get an early diagnosis of pancreatic cancer when it can be treated and maybe even cured. Right now, most of the pancreas cancer diagnoses are made very late, and I think the 5-year mortality of pancreatic cancer is in the vicinity of 20 to 30%. And so we need to find ways of getting tests that give us an earlier diagnosis of pancreatic cancer.
Dr. Callender, what would happen if you did like have a positive test from this screening? What could you do to prevent the?
Well, what you could do is get a pancreatic scan, MRI of the pancreas, to see if you find evidence of pancreas. And if you find an early pancreas cancer, then that can be treated by surgery or other methodologies. So an early diagnosis would result in perhaps a cure of pancreatic cancer, which we are not good at right now.
Right.
Okay, we'll let this be the last one because I've got to leave.
Is
And this,
pancreatic cancer more aggressive so that it metastasizes more quickly than other cancers?
well, that's a good question, although the answer is not as good as the question, because the problem is we make the diagnosis so late that we don't have a good way of finding out. So if we make a diagnosis earlier, then we can operate earlier and actually cure the pancreatic cancer. Whereas if we make the diagnosis late and the cancer is more aggressive and we can't eliminate the cancer, then So that's why a test that makes an earlier diagnosis may well help us to do a better cure of pancreatic cancer, which it really occurs. It does occur though, but it occurs when a diagnosis of pancreatic cancer is made early, when before symptoms occur, and that's what this blood test may provide for us. We shall see. Thank you very much for your attendance, and sorry I've got to leave so early, although 10:30 is not really that early. But thanks for attending, and have a good weekend.
Dr.
Thank
Callender,
you.